In just a few hours, Australia's second biggest state will join Greater Sydney in lockdown. The outbreak, which began here, is now having severe consequences in Victoria. More on that shortly. Our Premier, though, is urging us to stay the course. The numbers appear to be stabilising. There are 65 new COVID cases, a significant fall on the last few days. But today's worrying figure is 35. This is how many people were infectious in the community. Gladys Berejiklian says there's still the risk the Delta strain will take off. We have reporters standing by in key locations tonight. We begin with Kathleen Calderwood in southwestern Sydney.
بس أكيد لو كنت هلا أنا أخذ الفاكسين يمكن ما كنت هون.
A cautionary tale from the COVID ward. Khalid Al-Masri is a father of 4 aged in his 40s. Pondering how this could have been prevented.
صعب كثير. أنا صار لي كم يوم هلا شوي رجعت عم بقدر أحكي نفسي رجع شوي.
GP Jamal Rifi published the video with permission. It's spoken in Arabic to get the message out to his local community.
We had about 9,000 people who watched that video, and I had numerous phone calls from community members inquiring how they can get a booking for the vaccination.
But worrying authorities is that people with COVID symptoms are going to their doctors or pharmacies.
If you're worried about your health condition and have symptoms, please call a health clinic, your GP or somebody on the phone. Do not present yourself to a pharmacist or a medical centre or a GP clinic.
This chemist at Wetherill Park has been deep cleaned multiple times.
We've been having to isolate staff, have new teams come on board, have them test through the testing sites at the moment just to keep everybody safe.
Infections are taking place in hospitals too. Some staff from Liverpool Hospital have been forced into isolation, and a nurse from Westmead's COVID ward caught the virus despite wearing protective gear.
That Westmead nurse was fully vaccinated and didn't have any symptoms. We know the vaccines are highly effective in protecting against severe disease.
Liverpool Ambulance Station is being deep cleaned after 3 paramedics caught the virus. One was already in isolation after coming into contact with a COVID positive patient. Staff have been told they can continue working as normal until they're advised on whether they're considered a close or casual contact. Kathleen Calderwood, ABC News, Sydney.
Let's go live now to Cayman Gok at Rozelle in Sydney's inner west. Cayman, there are concerns about workplaces where the virus is spreading.
Well, Jeremy, one of those workplaces is the West Connects, where tonight we can confirm 3 delivery drivers supplying materials to the project have tested positive. Now, this is an enormous project with tentacles right across Sydney. It's unclear whether these cases are linked to a Greenacre cluster where 4 Hanson employees have been diagnosed, plus 9 workers at a neighbouring asphalt business. Now, the Transport Workers Union is furious. It says the truck driver told Hanson he had the virus as early as Saturday, but the company didn't inform other staff until today, when New South Wales Health shut down the worksite.
I think they were putting profit before safety. They were very much concerned about losing their contract with Transurban West Connect. I mean, this is outrageous.
Now, Hanson strongly disputes this. It says it was first alerted to the public to the positive case on Tuesday, where contact tracing began immediately, and it is cooperating with authorities. Jeremy?
And Cayman, you've also got details on a COVID scare at a nursing home in Western Sydney. What can you tell us?
Yeah, Jeremy, a cleaner at Minchinbury Manor in Rooty Hill has tested positive. The aged care home says it's in lockdown as a precaution. We understand about 90% of its 130 residents are fully vaccinated, but all staff and residents will be getting swabbed daily. As for the cleaner and 5 of their close contacts at the Minchinbury, they are all now self-isolating. Jeremy?
Cayman Gok reporting. The Premier is coming under increasing pressure for not declaring who are essential workers. Her daily media conference was tense today. At one point, Gladys Berejiklian pleaded with reporters to stop shouting at her. The Premier says her government is far from perfect, but insists it's following health advice. Here's state political reporter Ashley Raper.
The Premier's increasingly feeling the heat over the decisions made so far.
The settings we have in place are having an impact. The settings in place are having an impact.
The cases of COVID-19 aren't increasing exponentially, but the number of cases that have been infectious in the community is remaining consistently high. That number needs to be zero or close to it for the lockdown to end. And at this stage, the government maintains restrictions don't need to be tightened to help achieve it.
We rely on the best health advice available.
What is the health advice that is saying that these settings are right?
So clearly we're wanting to further decrease mobility and interactions.
The focus seems to be not on strengthening the stay-at-home orders, but on ensuring compliance.
I'm just going to emphasise to the employers throughout New South Wales, please understand there actually is a health order requiring you to allow your workers to work from home unless they really can't.
The retail and construction sectors can keep operating, even though the virus has spread as a result.
Why won't you set an example by ceasing work on some of your own infrastructure projects?
Can I say the following in relation to that? And that is that we know that those organisations that are continuing work are doing so in a COVID-safe way.
And the government is continuing to refuse to define what it considers essential work.
Why not tighten that though? The Victoria did it very successfully, and you're saying we...
No, they didn't.
When pressed on the success of New South Wales's model...
Sorry, one question at a time. I'll get to all of them. It's not really nice being shouted at.
The Premier made a concession of sorts.
I'm not pretending this is easy. I'm not pretending that there's perfection in the settings. There never will be, no matter where you draw the line.
It's a fine line to walk when lives and livelihoods are at stake. Ashley Raper, ABC News, Sydney.
And Ashley's with us live now. Ashley, here we are almost 3 weeks into a lockdown and there's still so much confusion.
There is, Jeremy, and a lot of that comes down to the government's messaging, which has been problematic from the start. You may remember when the lockdown was first announced, the Premier refused to even use the word lockdown. That quickly changed, but it wasn't until yesterday that the language was strengthened to convey the message that this is a hard lockdown. There have also been changes to restrictions and guidelines around testing along the way, which has undoubtedly added to this confusion, and that played out at Fairfield testing sites on Tuesday night. Another issue is the failure to define essential work, and that puts a lot of pressure on individuals to navigate the public health orders as well as the government's message. There is still a lot of goodwill towards the Premier and confidence in her approach, but there is a lot of frustration too. And Jeremy, if this situation doesn't start turning around, that frustration will only grow.
Ashley Raper reporting. Southern New South Wales is on high alert after 3 service stations were added to the list of COVID exposure sites. Anyone who attended this service station in Gundagai in the early hours of last Thursday must get tested and isolate for 14 days. Further south, locals have turned up in droves to get tested after a petrol station in Gindera, north of Albury, was visited by an infected person on Saturday morning. A service station in Hay is also on the list, with an alert issued for Saturday. Now to Victoria, which is being forced into a 5-day lockdown from midnight. Let's go to Jessica Longbottom at the MCG. Jessica, why has the Premier taken this decision?
Jeremy, we've got 18 cases in Victoria. 4 of them were announced today. 3 of them happened here at the MCG on Saturday afternoon. These were cases of stranger-to-stranger transmission, and that is what has the government worried. They don't usually see the COVID strain transmitting in a well-ventilated environment such as this, and this is what they say has forced them to act. We're now going into lockdown from midnight tonight. Victorians won't be able to travel beyond a 5-kilometre radius. They'll only be able to leave home for 5 reasons. That's for caregiving, for work, to go and buy food, to be vaccinated, and also for exercise. Now, the Premier has said that he is hopeful it will only be 5 days, and Victorians certainly will be hoping that as well.
Jessica Longbottom in Melbourne.